Culture of oocyte, S/embryo, S, less than 4 days. With CO culture of oocyte, S/embryos. Eggs, oocytes, or previously fertilized embryos are kept in an incubator in a petri dish culture for less than 4 days in 89,250. Code 89251 is reserved for those instances when CO culture techniques over and above those normally required are performed. Assisted embryo hatching, microtechniques, any method. Assisted embryo hatching is performed in selected cases on the day of embryo transfer. A pipette is placed on one side of the embryo to keep it from moving. A very delicate, hollow needle called a hatching needle is placed on the other side of the embryo. An acidic solution is expelled from the needle against the outer shell, zona pellucida, of the embryo. The acidic solution digests a small area of the outer shell. The embryo is washed and replaced in the culture solution in the incubator. Oocyte identification from follicular fluid. Upon aspiration of the follicle, specially trained personnel use a microscope to search for the oocyte cumulus complex, which includes the egg and surrounding cumulus cells from the ovary. This is accomplished by pouring the collected fluid into flat dishes and using a microscope to search for eggs. Preparation of embryo for transfer, any method. After the embryos have been cultured for 2 to 6 days, 3 to 4 healthy embryos are selected for transfer. Selected embryos are loaded into a transfer catheter. In a separately reportable procedure, the catheter is placed in the cervical canal and the embryos are transferred into the uterine cavity. Sperm identification from aspiration, other than seminal fluid. This procedure reports microscopic examination of aspirated fluid for the presence of sperm. Cryopreservation, embryo, S. Embryos not required for current uterine transfer are frozen using a process referred to as cryopreservation. Pre-implantation embryo preservation is a relatively new procedure as compared to sperm preservation, C 89259, but more than 2/3 of the embryos survive the cryopreservation process and can be preserved for an indefinite period of time. Cryopreservation, sperm. A cryoprotectant, usually glycerol or dimethyl sulfoxide, DMSO, is mixed with the semen to reduce damage to sperm during the freezing process. The semen specimen is placed in a vial and frozen in liquid nitrogen at -196 C. This halts all biologic and metabolic processes, allowing the sperm to be preserved for many years. Sperm isolation, simple prep, e.g., sperm wash and swim up, for insemination or diagnosis with semen analysis. Sperm isolation, complex prep, e.g., Perkel gradient, albumin gradient, for insemination or diagnosis with semen analysis. Prior to insemination or further diagnostic studies, the sperm go through a spinning and washing process in a series of solutions. The purpose of this is to separate sperm from seminal fluids, allowing the sperm to go through a process referred to as capacitation. Capacitation is an invisible change mature spermatozoa must undergo to acquire accelerated movement, allowing them to navigate through the uterus and fallopian tube. In addition, this procedure checks the ability of the sperm to swim in a forward progressive fashion. This complex prep includes a Perkel gradient and albumin gradient. This procedure includes a semen analysis, count, motility, volume, and differential. Sperm identification from testis tissue, fresh or cryopreserved. A small amount of testicular tissue is taken for microscopic evaluation for the presence of sperm. This test is used only when no other means is available of obtaining a sperm sample because of the possibility of causing further testicular damage. Insemination of oocytes. The sperm is prepared through a washing method, which separates the sperm cells from the seminal fluid. The washing filters out white blood cells, prostaglandins, and other debris, as well as cells with less motility, to provide the highest concentration of viable sperm. Once the concentrated spermatozoa have been prepared, they are placed in a culture medium with the eggs. If injection is required for fertilization, the protective coating of cells is removed from the egg and the sperm cell is directly injected. Extended culture of oocyte, S/embryo, S, 4 to 7 days. Culture of eggs, oocytes, or embryos usually occurs for 48 to 72 hours. This code describes an extended period of time for the cells to incubate in a culture medium, which will improve the identification of the most viable embryos. It is sometimes necessary to wait up to 5 days for the embryo to become a blastocyte before implantation due to high risk of multiple gestation or repeated IVF failures. Assisted oocyte fertilization, microtechnique, less than or equal to 10 oocytes. Greater than 10 oocytes. Assisted oocyte fertilization is done with microtechnique. A single sperm is injected into the egg, oocyte, to enable fertilization when sperm counts are very low or when sperm are non-motile. It requires micromanipulation of the sperm, which is also referred to as microtechnique. The usual method involves intracytoplasmic sperm injection, ICSI. Using ICSI technique, the mature egg is held in place with a holding pipette. A very delicate, sharp, hollow needle is used to immobilize and pick up a single sperm. This needle is inserted through the egg's outer shell, zona pellucida, into the cytoplasm of the egg. The sperm is injected into the cytoplasm and the needle removed. The eggs are checked the next day for evidence of fertilization. Report 89,280 for 10 oocytes or less and 89,281 for more than 10 oocytes. Biopsy, oocyte polar body or embryo blastomere, microtechnique, for pre-implantation genetic diagnosis, less than or equal to 5 embryos. Greater than 5 embryos. Biopsy of an egg, oocyte, polar body or embryo blastomere, an embryo with 6 to 8 cells, is indicated for patients who carry genetic disorders such as sickle cell anemia, hemophilia, Fragile X syndrome, and others, and for those experiencing difficulty with a successful IVF or ICSI. The process of a biopsy includes inserting a microneedle into a fertilized egg to extract polar bodies of the oocyte, or to extract a single cell from a 6 to 8 cell embryo. Screenings are performed through the process of FISH, fluorescent in situ hybridization, and PCR, polymerase chain reaction. During FISH, a small amount of DNA is analyzed through staining of fluorochromes. PCR is able to detect gene sequences or single genes, which may have abnormal mutations. Semen analysis, presence and/or motility of sperm including Hühner test, post-coital. Motility and count, not including Hühner test. Volume, count, motility, and differential. Sperm presence and motility of sperm, if performed. Volume, count, motility, and differential using strict morphologic criteria, e.g., Kruger. Semen analysis is generally performed in specialized infertility/andrology laboratories. Sexual activity culminating in ejaculation should be avoided for a minimum of 48 hours prior to testing. In 89,300, a post-coital specimen is obtained using a cervical swab. The test is timed to coincide with ovulation. Semen is tested for the presence, quantity, and/or motility of sperm. In 89,310 to 89,322, semen is collected using a condom-like seminal fluid collection device or by masturbation into a sterile container. Only sperm movement, motility, and number, concentration or count that measures how many million sperm are in each milliliter of fluid, are performed. Code 89320 reports a semen analysis that includes measurement of the ejaculate's volume, number, structure, shape, of sperm, sperm movement, motility, and direction of movement, forward motility. In addition, fluid thickness, acidity, and sugar content may be evaluated. Code 89321 tests only for the presence, quantity, and/or motility of sperm. In 89,322, a detailed evaluation of the shape, morphology, is performed utilizing specially stained slides and microscopic examination of the sperm under high-power magnification. In order to be considered normal, the sperm must meet a strict set of criteria regarding the shape and size of the head, midpiece, and tail. A Kruger test is helpful in determining which reproductive techniques and methodologies may be most appropriate and successful. Tests reported with 89,300 to 89,322 may be accomplished using a variety of methods including semen function tests and computer-assisted sperm morphology/motility studies. Sperm antibodies. This procedure tests for anti-sperm antibodies. A semen sample is placed with immunobeads. Alternately, the semen sample may be placed with human or bovine cervical mucus together in a laboratory medium. The sperm antibody may be present in vaginal fluids or the male's blood or semen. Anti-sperm antibodies bind with the sperm, inhibiting movement and their ability to fertilize an egg. The sperm appears clumped together on microscopic examination. Sperm evaluation, hamster penetration test. This test is also called sperm penetration assay, SPA, or hamster zona free ovum, HZFO, and tests the ability of the sperm to penetrate a hamster egg, which has been stripped of the zona pellucida, outer membrane. The patient should abstain from sexual activity culminating in ejaculation for a minimum of 48 hours. Semen is collected post-coitus using a condom-like seminal fluid collection device or by masturbation into a sterile container. Upon receiving the specimen in the laboratory, the sperm is washed and placed in a culture medium along with a single hamster egg. It is examined periodically using phase contrast microscopy. The test measures the ability of sperm to capacitate, invisible change which allows sperm to navigate rapidly forward, acrosome react, structural change fusing the outer membrane of the acrosome with the plasma membrane of the sperm head, freeing enzymes in the acrosome which facilitate entry into the ovum, and fuse with the ovum. Sperm evaluation, cervical mucus penetration test, with or without spinnbarkeit test. Sperm mucus interaction is assessed in vitro. Human or bovine ovulatory mucus is placed in a capillary tube. Sperm penetration is measured over a period of 90 minutes. Sperm progression measures which sperm have progressed the farthest down the tube. Patient sperm penetration can be compared with fertile sperm specimens using in vitro methods. Sperm evaluation, for retrograde ejaculation, urine, sperm concentration, motility, and morphology, as indicated. Retrograde ejaculation, in which the seminal fluid travels backward into the bladder following ejaculation, is often seen in patients with diabetes, or in men following transurethral surgery at or near the bladder neck, dissection of the retroperitoneal lymph nodes, or spinal cord injuries. The patient may present with low semen volume, motility, movement, and sperm concentration, count. In a urinalysis performed immediately after ejaculation, the specimen is examined under the microscope for the presence of sperm. If detected, the specimen is further processed to evaluate the concentration, motility, and morphology, shape. Cryopreservation, reproductive tissue, testicular. Storage of reproductive tissues is cryogenically maintained at an appropriate facility. A cryoprotectant is added to reduce cellular damage and the tissue is placed in vials, straws, or test tubes. The tissue is gradually frozen in the vapor of liquid nitrogen. Once frozen, the tissue is stored in liquid nitrogen at -196 degrees centigrade. Report 89335 for testicular reproductive tissue cryopreservation. Cryopreservation, mature oocyte, S. Cryopreservation is a technique of freezing and maintaining cells at extremely low temperatures to preserve the genetic and metabolic properties of the cell. The mature, M2, oocyte specimens are first preserved in a cryoprotectant solution to reduce cellular damage and the tissue is placed in storage vials. The sample is gradually frozen in liquid nitrogen. Cryopreserved samples are stored at temperatures of -80 to -196 degrees centigrade. The amount of cells being frozen, the source and amount of protective solution used, and the cooling technique may vary. Oocyte cryopreservation, OC, enables patients who may be susceptible to losing ovarian function to preserve reproductive potential through the use of long-term storage of oocytes. Storage, per year, embryo, S. Sperm/semen. Reproductive tissue, testicular/ovarian. Oocyte, S. These codes report the long-term maintenance of preserved reproductive tissue samples and fertilized embryos in an appropriate storage facility per year. Thawing of cryopreserved, embryo, S. Sperm/semen, each aliquot. Reproductive tissue, testicular/ovarian. Oocytes, each aliquot. Thawing of cryopreserved tissue requires thawing in different substances for set lengths of time so as to maintain the integrity of the specimen and prevent damage by thawing too quickly. The cryovial is removed from the liquid nitrogen and placed at room temperature until ice crystals have dissolved. A water bath is prepared at the desired temperature in which the specimen is placed. After the water bath, each specimen is placed in a series of solutions to complete the thawing process.